Hello everyone. The topic we cover today is bedside clinic. So welcome to the bedside clinic. It is an important clinical teaching method. So this particular topic which comes under the communication and educational technology subject for BSc nursing second year students. Okay, now we will move to the bedside clinic. So what is a bedside clinic? So the bedside clinic, it is a systematically organized clinical instruction in the presence of patient. Okay, the definition says that it is a systematic, it is a planned and it is an organized way will conduct a clinical instruction. Clinical instruction in the sense it may be related to the various disease condition and various clinical procedure, especially the nursing procedure that is used or that is done for the patient. In the presence of patient, clearly the clinical instructor or the nurse educator will explain to the student. And this method, the bedside clinic, is a purely teacher centered method. That means the the teacher is having an active role. The clinical instructor or the nurse educator is having an active role in presentation of bedside clinic, and the students will be like a passive listener they will be. And it is mainly done for a small group of students. So that is the bedside clinic. So we can say the bedside clinic, it is an organized, systematic clinical instruction in the presence of patient. Now we will see what are the purposes of bedside clinic. So the bedside clinic, which gives a direct and real experience to the student and which improves the learning behavior or learning experiences, then which is helpful for the planning of nursing care. That is, especially the nursing process can be adopted and it can be implemented through this bedside clinic. And now we will see the steps of nursing clinic or bedside clinic. So while coming to the step, the prior information should be given to the students regarding the patient's name or the disease condition. So we will give a prior information so that the students themselves they can prepare for the learning experiences. That is the first step of nursing clinic or bedside clinic. And the next one, we have to obtain a consent or permission from the patient and from the relatives, because we are doing this bedside clinic with the presence of patient itself. Then we will move to the bedside clinic. So first we will get the permission from the patient and relatives, and we will inform to the students also. And this bedside clinic can be conducted near the bedside also. That's why we are saying it's a bedside clinic near to the patient itself. Or we can conduct this one, we can take this patient to the clinical teaching room or demonstration room that is attached to the ward itself. So any of the area we can conduct the bedside clinic, and usually it lasts for 30 to 45 minutes. Regarding one patient's disease condition, detailedly we will discuss within 30 to 45 minutes. That is the duration of bedside clinic. And during this bedside clinic, we should not do or we should not tell anything to the patient that will make humiliation or it embarrass the patient. And if the patient's condition allows, so we can ask the patient to brief his details regarding his condition or his experiences. We can ask the patient to brief. Then after that, the clinical instructor or the nurse educator will explain regarding the disease condition in detail, what's a nursing care or what are the medication the patient is taking, or all that details, especially the nursing aspect mainly will focus on the bedside clinic, including the disease condition, patient's reaction to the disease condition, or what are the diagnoses made, everything will be discussed in this particular bedside clinic. So after this one, the clinical instructor or the nurse educator can instruct any of the students, those who are taking care of the patient for the past few days, they can also give certain suggestion or they can give opinion regarding the patient's condition. So after this one, the clinical instructor or the nurse educator will allow the students to interact with the patient. So after this interaction, the patient can be set free or we can allow the patient to go back. That means it is not a compulsory that the patient has to be present throughout the procedure. So once with the patient interaction is over, we can allow the patient to go back. So after this one, we'll end up with a summary and students feedback. So that is the steps of bedside clinic. And we will move to the advantages and disadvantages. If you come to the advantage, the students are having or students are getting a direct information regarding the disease condition, and they are getting a direct symptoms or clinical features directly from the patient. A real life situation will be produced and we can compare. There will be a comparison with the disease condition, that is practically we can compare with the actual what we study in the textbook. That comparison can be done here. Then we will come to the disadvantage. So, here also we need a proper planning, and sometimes the patient will be having some problem. If the patient's condition is not allowing, or in between if the patient is getting any complication, we cannot continue with the bedside clinic. Then another disadvantage, we can go for only a small group of people, only a small group of students can be taken for the bedside clinic. Okay, so that is a bedside clinic. So here we have seen what is a bedside clinic, what are the steps, advantages and disadvantages. That's all for today's class. This is Vishant signing off till we meet the next class.